So welcome to our low carb group, which is where we aim to really help and repair people's metabolic health. So whether your focus is on weight loss or type 2 diabetes, pre-diabetes, even type 1 diabetes, fatty liver disease, high blood pressure, or even if you need support improving your overall cholesterol, we're here to help. But you don't want to hear just from me. We've got some amazing people that have joined us. I've actually been through the low carb support, the online group that we run, and so we're going to hear a little bit from some of them now. So first of all, let me just go to Mark. When you joined the group, this online group and this online course, what was your actual goal? What were you looking to get out of it?
So for me, the goal was really my HbA1c numbers were creeping up over the months, and I really wanted to correct that and push them back down. So really, I was trying to find out get an understanding of what the good foods, what the bad foods were in respect to carbohydrates, and then understand what I need to do to get these numbers down to a point where hopefully I can go to my diabetic nurse, Carol, and have a constructive conversation with her in respect of reducing the medication, or even ultimately after a longer period of time, trying to come off the medication altogether. My numbers currently, prior to the course, were at 69 HbA1c. I'm now sitting at 51. So hopefully this has all been a very great success, and I'll keep pushing those numbers down.
Brilliant. Lovely. Thanks, Mark. What about, let's go to Lynn. So Lynn, how did the program help you?
Oh, it's changed my life completely. I've lost nearly 2 stone. I have more energy. I'm not using my walker anymore. And my diabetes is much better. I'm still on the tablets, but my HbA1c, it was 69 in September and it's now 45. So I'm really, really glad. And apart from that, I mean, don't even think about carbs anymore. So, but I just think about things that I can eat, like cream and butter and cheese, and it's amazing. It's amazing. I think that, you should go on it, because I was a bit doubtful, thinking this won't work, but it does. It does work. I don't know how, but it does.
Brilliant, Lynn. That's fabulous. Well, let's turn to Sandy. When you went through the course, what benefits did you see? Were there a few, or were you just looking for weight loss?
No, I was. I've had a lot of results from when I started on the course, which has changed my life. It's fantastic. The support and advice which I gained from the course was fantastic. I've lost some weight. My HbA1c in 6 months has come down from 94 to 50, and I have now lost over 2 stone. My mental health has improved dramatically, and I have been very lucky, and I've been able to come off of all my diabetic medication. So for me, the results from doing this course have been absolutely amazing. I can't recommend it enough.
Oh, that's fabulous. Fabulous. Oh, well, thank you for that. So let's go to Michael. So Michael, you mentioned you had some pretty impressive weight loss as well, didn't you?
Yeah, I had a lot to lose though. So what I would say is that as a typical bloke, I was a skeptic. I thought, what the hell, I'll have a go. And it has essentially completely changed my outlook on food. It's changed my outlook on dieting, bizarrely, because I haven't really had to diet. I've just been careful what I've eaten. And it's not been as painful as I expected, not eating pasties and cakes and things. It could have been a lot harder, but actually it's with the support of the course and the ongoing sort of motivations that you get through the WhatsApp groups, it keeps you focused. And Yeah, it's kept me skint as well because I've had to buy a whole new wardrobe. But hey ho, worst things can happen. So I would recommend it for anybody that doesn't want to diet, actually, because you don't need to weigh what you're eating. You don't need to be a slave to an app. You can essentially just cut out carbs and be mindful that you don't have over 5 grams per 100 in any carbs that you eat, and that's all good.
And it keeps it nice and simple. Michael,
Absolutely.
thank you for that. I've got to turn to Aileen now. So Aileen, you're probably coming at this from a completely different perspective, weren't you? Because you're a type 1 diabetic. And can you sort of explain how the course affected you?
Oh, it's completely transformed my life. I've been a type 1 insulin dependent diabetic for nearly 30 years. I'm now using over 75% less insulin. My glucose levels are steady and I've lost over 2 stone. And for me, for the first time in my life, I now feel in control.
Oh, just fabulous, fabulous. So you would certainly recommend it for other type 1s?
I would most definitely. I mean, I know how overwhelming being a type 1 diabetic can be. This program gave me stability and confidence that I didn't think was possible. I'd encourage any type 1 to explore it with their diabetic team, because no one should feel like they're stuck on a roller coaster when you have a chance of making a difference and feeling so well.
Great, lovely. Thanks, Aileen. Let's turn to Sandra. So Sandra, why did you actually join the course, Sandra?
I'd been ill last year. I was very fatigued, no energy, low mood, and very overweight, just about verging on pre-diabetes. And it's changed my whole life, and it's brilliant. I just feel so much better now.
What sort of benefits did you see?
Well, I've got more energy. I've lost nearly 3 stone. I'm now swimming several times a week, half a mile at a time. I've even joined the walking netball and been scoring goals, which I hadn't done for 50 years. It's been absolutely brilliant. My blood pressure meds were reduced by half within 3 weeks of starting the course.
Right.
It's just brilliant. So I'm hoping to, reduce them further soon. So,
Fabulous.
and it just totally changed my life, really. It's just been a brilliant course, and I'm really happy to be here on this video to spread the word to everybody, because everybody needs to know about it.
Thank you. Thanks, Sandra. All right, I've got to go to Mike now. So Mike, you saw some pretty impressive improvements in your HbA1c and your weight, and then that led you to something else which was quite remarkable, really, wasn't it?
Yes. My original HbA1c was 59. Within 3 months I got it down to 37, and then since then I've remained at 37. I was off the meds within 3 months. And in 2024, I suffer with arthritis in my knees and one of my shoulders. In 2024, I climbed Ben Nevis and had no problems with the arthritis whatsoever. So the diet, the food, low carb, helps with pain relief as well. I'm now a mad DIYer anyway, and I don't even bother wearing knee pads like I used to when I'm kneeling doing projects.
Wow. Well, well done. Well done. It wasn't just Ben Nevis, either, was it? There was another one as well, wasn't it, that you did?
Well, I'd climbed Snowdon in 2018 and Scarfell Pike in 2019, which was before I was diagnosed.
Okay.
And basically had to rest for 2 days after each climb because of the pain in my knees. I was on painkillers and a pain relief system that we had. The pain relief system sits in the bottom of the cupboard now and hasn't been touched in 4 years.
Wow.
Fabulous. Brilliant. Thanks, Mike. Right, Linda. So Linda, just looking down here, you said that the course changed how you looked at food. Can you explain that a bit?
Yeah, before I would just sort of go and do my shopping and just not really think about it and pick up foods, just put them in the trolley and come home and pack them away. But now, having done the course, it's like I look at the labels now and I think, my goodness, I'm not going to buy that because it's got loads and loads of carbs in. And experimenting with food, like the bread that we've done, the mug bread, and looking at other recipes and finding ways and eating some different foods as well. So that's been really good for me. And I'm type 3C, so can I just say that I was sceptical as well when there was a lot of talk about type 2, but I persevered. I nearly gave up the first week sort of thing. I thought, nah, it's not for me. But then to persevere, I thought, yeah, actually, it does apply to me as well.
Great. Linda, that's fabulous. Thank you very much. Right, Bridget. So, Bridget, you mentioned that you saw some improvements in your health following the course, and I guess you'd had a few issues leading up to it, hadn't you?
Yeah, I did. Yeah, I had fatty liver. And when I started the course, I was already had food issues anyway, with restrictions because of stomach issues. And I lost quite a bit of weight initially, and then went on to heal my fatty liver within 3 months. And I also was found out from the HbA1c blood test I was pre-diabetic and insulin resistant. And I went on to lose 1.5 stone, 11 kilos, and I've kept that weight off. It's made a huge difference to my life.
Fabulous. Thank you, Bridget. Mark, let me come to you. So you mentioned that you had sort of quite an important message really for other people, and I guess you want to talk about what you'd learned the most.
Yeah, I think so. I mean, there are so many messages from the courses, so much knowledge and so much information, and passion as well. Everybody wants to help on the courses, and after that, somebody's already mentioned about the WhatsApp group. Absolutely a prerequisite for me. It's my busiest group on my phone. I think I said that already when I joined. But yeah, there are so many messages. It's a marathon. It's not a sprint. Do what works for yourself. We're all different. A good one that I always like to remember is be kind to yourself. Don't berate yourself. Don't feel that you should do better and beat yourself with a big stick. But really, I think for me the most important thing, we hear it so many times, that this is not a diet. Absolutely not a diet. That is a swear word now. It's not a diet. It's a lifestyle change. And I think if you can get your head around that, link with the other few little messages that I've put there, you will never look back once you join this course, because like so many we've already heard from, it has changed my life in a massive way. And I haven't got time to explain that, and you probably will be asleep by the end anyway. But that's my big message. It's not a diet, it's a lifestyle.
Yeah, very important to remember that. Okay, thanks, Mark. And then finally, I've got to come to Marjorie. So Marjorie helps me run a lot of, all our groups, as we currently do, four times a week. And I think for you, there's something about sort of the magic of the group, isn't there? Can you sort of elaborate on that?
I followed this pathway for 4 years by myself with the support of a GP. But it's finding the group, the power of community, how we can all be out there and support each other. The private messages that sometimes go backwards and forwards when you realize somebody's having a challenge, and the genuine friendships. I think that it's tremendously powerful. It's become a really, really important part of my life. And I think that just being able to support each other and help each other and spread the word is incredibly powerful. Incredibly powerful.
It's an absolute pleasure that I've been able to work with you over the last few years delivering these courses. So all our groups are online on Monday mornings at 9:30, Monday, Wednesday, or Thursday evenings at 6 o'clock. So please ask your surgery for a referral, and we can't wait to meet you all. Thank you so much for sharing everything today, and keep up the good work, everyone.